The next guest speaker needs no further introduction. He's been involved in pain management for many, many years, both in private practice and academics. He's been assistant professor of anesthesiology and pain medicine at Harvard Medical School, working at the prestigious Beth Israel Deaconess Medical Center up until a year ago, when he decided to dedicate himself to studying hypnosis, acupuncture, and core-integrative movement. Welcome Dr. Ben Cohen to talk to us about hypnosis.
Thank you. So I've been out of academics for about a year. I miss it. I'm serving briefly as your acute pain newsletter editor, and I would be delighted to hand that over to an enthusiastic person who would like to continue that. My disclosures are basically my consulting work with Elvira at Hypnoalgesic and with at CATS, Analgesic Solutions. So the strain and the pain is in the brain. I don't know who to credit that to, but one of the people in this room has made that an important theme. We just heard from Beth that pain is an experience that is more than the information carried by our peripheral nervous system. When we do feel something, if I've been bitten, is it a mosquito? Is it a bee? Is it a tiger? And I have to worry about it, or oh, I can deal with that, I had that before. We know that in patients who are not unconscious having procedures, that the longer the procedure goes, the more it becomes a problem managing their pain. This is old information, colonoscopy, and I want to talk just briefly about time course. Here are 3 studies that are charting pain over time. The blue is tumor embolization. The red is interventional radiology treatment with peripheral vascular disease and renal problems, and the yellow is breast biopsy. And the cancer patients start with a little bit more pain, the other patients don't. And over time, pain seems to increase, and that process continues. And the longer it goes, the worse it gets. Beth has just mentioned some possibilities that the brain can be immunized against the development of chronic pain. The factors in the study that I'm going to describe, or studies that I'm going to describe, are twofold. One is use of hypnoidal language, avoiding negative affect, minimizing the nocebo phenomenon. It's clear that from the review of the tapes that were done in our group, that there were a lot of painful stimuli, and it was possible by reviewing those tapes to chart what the provider was doing prior to those painful stimulation. Interestingly, if they warned before the stimulation, this is going to sting, this is going to burn, the patients actually had experienced an increase in pain compared to cases where the provider wasn't doing that. Same for anxiety. And interestingly, if the patient then had a response. I guess they were doing what they were expected, and then you were sympathetic with it, although pain didn't differ. Anxiety did. Anxiety increased just because the provider was sympathizing after the stimulus. Clearly it matters how we behave with our patients and what we say and how we say it.
Okay, you're gonna feel a pinch, a lot of burning and stinging, okay?
And then it'll stop. It's
Then
quick.
it's-
Just imagine
Okay, I'll let you know. This is a pinch.
cool sensation
Pinch,
just
okay.
floating through your
Burning
skin.
and stinging.
You're doing great. Just
How you
keep
doing?
going.
Is that okay?
Yeah. Remember to breathe. You're doing fine.
Pinch.
Just imagine a cool, numbing sensation.
You feel that? More stinging.
I can still feel a needle in there.
Yeah. You feel a needle, but do you feel any sharp pain? Okay.
You feel something moving, but nothing painful.
Well, nothing sharp,
I
right?
feel prickly, yeah.
It's a little bit easier to have you sedate it with this. You want to make sure you're a little
Are you
bit.
feeling
You
that?
feel, what was that? Sharp?
Uh-huh.
Sorry.
It hurts.
Sorry.
Is it-
Easy
Oh,
more, easy more. It's okay. Keep breathing. You're doing great. Deep, easy breath.
it kills.
You still feel
Oh, yes. It
You still
hurts, it
feel
hurts,
it?
it hurts, it hurts, it hurts, it hurts.
There's nothing there now.
It kills.
It's
Still sting? It didn't sting before. Weren't you doing it before?
I'll give you some more local.
Wait, what did you just do? Like, probably the 3 times you injected me, it didn't hurt. It stung a little, but this feels like you, like, literally, like, cutting the flesh out of my chest.
Sorry about that.
Keep breathing.
Is it burning you?
If you take patients' experience away from them and tell them what they're going to experience instead of allow them to experience their own experience, they will cooperate. That was one of the tapes that was reviewed, and there were a lot of them like that. Dr. Lang, about 15 years ago, developed a short hypnoidal script that could be read in 2 or 3 minutes. It had a section that that you read to everybody, and if the patient reported that they were uncomfortable or in pain, there was a red section, and if they reported anxiety, there was a green section. And everybody after the procedure was reoriented. There was a lot of pushback to people who felt in a rush, that they didn't want to have to spend 2 minutes at the beginning of their case having this done. It wasn't the primary provider, it was an extra assistant in the room who would read the script. We want you to help us, to help you learn a concentration exercise to help you get through the procedure more comfortably. It can be a way to help your body be more comfortable through the procedure and also deal with any discomfort that may come up during the procedure. It's just a form of concentration, like getting so caught up in a movie or a good book that you forget you're watching a movie or reading a book. And you may be interested to learn how you can use your imagination to enter a state of focused attention and physical relaxation. If you hear sounds or noises in the room, just use these to deepen your experience. And use only the suggestions that are helpful to you. There are lots of ways to relax, but here is one simple way. On 1, you can do 1 thing, go. On 2, 2 things, slowly. close your eyes and take a deep breath. And on three things. Breathe out, relax your eyes, and let your body float. Good. Just imagine your whole body floating right through the table with each breath deeper and easier. And with each breath you take in strength. And with each breath out, stay calm. Right now, imagine that you are floating somewhere safe and comfortable. In a bath, a lake, a hot tub, or just floating in space with each breath deeper and easier. Just notice how with each breath you let a little more tension out of your body as you let your whole body float, safe and comfortable, each breath deeper and easier. Good. Now with your eyes closed and remaining in this state of concentration, please describe how your body is feeling right now. And the patient will interact. You can tell that things are going well and that you've been very successful in establishing rapport. Now this is your safe and pleasant place to be, and you can use it in a sense to play a trick on this whole procedure. And you can always return to it. Your body has to be here, but you don't. So just spend your time being somewhere you would rather be. Now, if there is some discomfort, and there may be some, there's no point in fighting it. You can admit it, but then transform that sensation. If you feel some discomfort, you might find it helpful to make that part of your body to feel warmer, as if you were in a bath, or cooler, if that is more comfortable, as if you had ice or snow on that part of your body. This warmth and coolness becomes a protective filter between you and the pain. If you have any discomfort right now, imagine that you are applying a hot pack, or that you're putting snow or ice on it, and see what it feels like. Develop this sense of warm, or cool, or delicious tingling numbness to filter the hurt out, the pain. With each breath, breathe deeper and easier. Your body is floating. Now again, with your eyes closed and remaining in the state of concentration, describe what you're feeling. And that's it. That's the treatment. And now proceed with the procedure, and the patient may need some reorientation and some reminders. And there's a special part of the script if they have discomfort or worry. And then at the end, okay, the procedure is completed. Now we're going to formally leave this state of concentration by counting backwards from 3 to 1. On 3, get ready. On 2, with your eyes closed, roll up your eyes. And on 1, let your eyes open and take a deep breath and let it out. That will be the end of the formal exercise. But when you come out of it, you will still have the feeling of comfort that you felt during it. Ready? 3, 2, 1. Take a deep breath. Feel refreshed and proud about having helped yourself through this procedure. Pain perception. Over time, pain increases. This is one of those 3 trials, the vascular intervention or the renal intervention. And these patients started with some mild pain. And over time, if we're looking at the blue line, the standard care, the pain increased as expected. And it continued to increase as time went on. The same thing that we found with all 3 different studies, and we are finding it with other studies as well. What about the intervention? Call it comfort talk rather than hypnosis, because it's about comfort. That's the red line. And interestingly, there really wasn't an increase in pain over time. In fact, there was a decrease. Spending 1 to 3 minutes reading that script, I'm not a professional psychologist trained in hypnosis, but just a healthcare assistant, medical assistant reading a script who's learned how to use the tone of voice and to and how to establish rapport with patients. Wait a second, what's going on? This graph has something's going on there with the red on the right at the bottom. Why didn't the red finish out? And what's going on here? The patients who had less pain, the procedures went faster. Less pain, less anxiety. They required less medicine. They were hemodynamically more stable and significantly lower cost. The hospital was not disappointed that the patients were happy and that it cost the hospital significantly less. I think it was $300 per case as opposed to $600 and something dollars. Well, here's one of those renal patients. He had flank pain, he has an infection, and he needs to have drainage, and that's going to be done by an interventional radiologist, Elvira, who's the developer of this NIH-funded project. This guy's obese. He's got problems with respiratory function, and he certainly would create a challenge in this position for any anesthetic. When asked about hypnosis, he surprised everybody and said, sure. And this happened to be a day that that a TV crew happened to be in the hospital.
It's extraordinary to watch those folks yesterday.
I'll tell you, it's very impressive if they're just pretending.
Yeah, exactly.
It's really impressive. And as we know, medical science now says hypnosis can be used in a mainstream, real way as a powerful tool to help patients reduce or refrain from pain medication, even avoid anesthesia during surgery. As we continue the special series Under the Spell, our medical editor, Dr. Tim Johnson, shows us some of the dramatic effects of hypnosis.
Hypnosis is not just for the labor room.
Just letting your whole body float through this table.
Robert Scott is having a kidney stone removed, his second, at Boston's Beth Israel Deaconess Medical Center.
Letting your body relax.
His doctor, Elvira Lang, says hypnosis reduces the need for pain medication, which often leaves the patient confused and weakened. And it works for Robert, who have undergone hypnosis while having radiologic procedures.
We found three things. The procedures are more comfortable, safer, and faster. I think it's just the state of focused concentration, like you're watching TV, you're reading a book.
Focused attention, reduce peripheral awareness, and enhance capacity to respond to suggestion. That's the definition of hypnosis, the new definition. Hypnotic induction is a deliberate procedure to get the patient into that state, and guess what? Every patient in the hospital is there automatically. Everybody's in trance who's a patient. Focused attention, reduced awareness, capacity for response to suggestion. Last night, it seemed like we were in for a change, and this morning brought you people. Thank you so much.